the second method I would like to discuss is the rolling stroke method. This method is typically coupled with the Bass method, Charters method, and Stillman method, and it can be used by itself, but usually it's coupled with those three methods as kind of a helpful aid in that particular brushing method. Some purposes for this is it can be used for children with relatively healthy gingiva and a normal tissue contour, or if the Bass method is a little bit more difficult, the rolling method can be a little easier for those with like dexterity issues and just can't visualize that 45 degrees and it still gets where they need to go. It's good for when you're practicing for other methods, such as the Stillman method, because of the initial brush placement is similar. It also can be particularly helpful when there is a question about the patient's ability to master and practice a more complex method. Some limitations with this method include when a patient is brushing during initial placement, it can be placed too high and the brushes can lacerate the alveolar mucosa. There is a tendency to use quick sweeping strokes, which usually results in the bristles not being able to get in that cervical third of the tooth in the interproximal spaces just because you're going too quick and the bristles just don't get a chance to get in there and don't really get a good clean in there. And if the tips are directed into the gingiva, it can produce punctuate lesions. Those are just a couple of limitations for it, and I'm just going to demonstrate the rolling stroke by itself, that when it's usually not coupled, it's just what it looks like by itself. So the bristles are going to be placed against the attached gingiva at a 45-degree angle, and the brush is slowly rolled by flexing the wrist and drag the bristles against the tooth with gentle, firm motion. The brush is rolled at least 5 times before moving on to the next section of teeth, and I'll do it on the anteriors here. So you're going to do 1, 2, 3, 4, and 5. And we'll do the same thing for the lingual here. I'll go on this side. Do 1, 2, 3, 4, and 5. And we're going to go anteriorly on the lingual here. And go 1, 2, 3, 4, and 5. And this is the rolling method.